Hey y'all, this is Rohit Verghese again with week 8 of QBank questions. So I have another set of 3 questions that I wanted to talk about this week. Now we're going to start off with the select all that apply question. A middle-aged client receives pyridostigmine to treat myasthenia gravis. The client suddenly develops severe muscle weakness, fatigue, bronchospasms, and bradycardia. The healthcare provider confirms the diagnosis of cholinergic crisis. Which action does the nurse take immediately? Now, even though this was a select all that apply question, there was only one correct answer. And so let me go over all the answer choices. Answer choice number 1 was assess the client's ability to chew solid foods and swallow liquids. Answer choice number 2 is to request that the healthcare provider increase the dose of pyridostigmine. Answer choice number 3 is place an intubation set at the client's bedside. Answer choice number 4 is to assess the client's Glasgow Coma Scale Score. Answer choice number 5 was to request that the tensilon test be performed. And so there was only one answer choice that was correct, which is answer choice number 3, but I selected 2, both answer choices 1 and 3. So answer choice number 1 is incorrect because while assessing the client's ability to chew and swallow is important for a client diagnosed with myasthenia gravis, doing so at this time is inappropriate because the client has severe muscle weakness and is at high risk for aspiration. And so this is why this answer choice is incorrect. And the only answer choice that was correct was answer choice number 3, which is placing an intubation set at the client's bedside. This is correct because the client is experiencing a cholinergic crisis and has bronchospasms. So the client requires advanced airway management. So we want to make sure that we have a intubation set at the bedside so that if anything goes even more worse, we can, help them establish an airway. So that's why answer choice number 3 is the correct one. Moving on to the next question. This is a normal type of question. It's just a prioritization question. Excuse me. And so the question reads, the unlicensed assistive personnel, or UAP, reports to the nurse that 4 clients are vomiting. Which client does the nurse see first? And so the answer choice that I picked, which was wrong, was answer choice number 2, a client diagnosed with cirrhosis of the liver with extensive ascites. And so this answer choice is incorrect because the client diagnosed with cirrhosis of the liver and extensive ascites is likely in liver failure, which puts the client at risk for dehydration, which is a potential problem. The vomiting is probably due to abdominal pressure from ascites, so this client requires medication for an expected finding and is not the most urgent. The correct answer was answer choice number 1, which is a client with the NG tube attached to low suction. This is correct because we need to assess for patency of the NG tube first. Clients should not be vomiting around an NG tube. The tube is there to maintain decompression of GI pressure and continuous removal of contents. The nurse must assess the client, check the NG tube, check the NG tube system, suction to ensure patency, and rule out emergent needs. So that's why answer choice number 1 was correct. Moving on to the last question. This was a short question. For some reason, I got it wrong. The question reads, the nurse instructs the client and spouse on how to suction the client's laryngectomy tube. Which observation indicates to the nurse that teaching is effective? So I chose answer choice number 3, which was the spouse applies suction while introducing the sterile catheter into the stoma. So I didn't know this, but a suction is only applied as the catheter is withdrawn, not during its insertion. So that's why answer choice number 3 is incorrect. The correct answer choice was answer choice number 1. The client takes several deep breaths before the suction catheter is inserted. And this is correct, because taking deep breaths hyperoxygenates the client's lungs and prevents anoxia during suction. So we want the client to have oxygen in their system and not be without it while we're suctioning them. So that's why answer choice number 1 is correct. And with that, we have the 3 questions that I wanted to go over this week. I hope you guys have a great day. Thank you.